I'm Dr. Kelly. Thanks for visiting the website voidtotally.com. This will be a brief 5 or 10 minute explanation of partial knee replacement that I do. This is an example of the knee. This is a knee arthritis. It shows that most of the arthritis here in red is on the inside part of the knee or the medial compartment, and I will call that the big toe side of the knee, and that's where most of the arthritis is in this patient. And so the options here would be to do a partial knee or a total knee if conservative treatments fail. Conservative treatments being cortisone shots or visco supplementation or medication, shoe wedges, and other things that we can do for arthritis that are non-surgical. Once you come to the surgical option, you're left with, for most patients, a total knee or a partial knee. Now, in this situation, most patients, a lot of them, have arthritis primarily affecting one compartment of the knee, either the medial compartment or the lateral compartment. And you can see here on this one, the medial compartment or the inside part of the knee is where it's red, is where it's worn out, and that's where all the pain is. If you're doing a total knee replacement, you'll resect the top 1/4 inch off the tibia and the bottom 1/4 inch off the femur, and you'll be left with a 1/2 inch gap that you're going to fill with metal and plastic for the total knee. Here's an example of a knee model showing the quadriceps tendon, patellar, and patellar tendon. For a total knee replacement, the incision is usually longer along this tendon down here, and then you would open the knee up and do the surgery and cut out the anterior cruciate ligament. Now with a partial knee replacement, which I'll explain here, is not as much bony resection. The incision is smaller. It's like 4 inches on the front of the knee from the top of the kneecap down. You make an incision along the patellar tendon and then a capsular incision along the vastus medialis muscle that comes in. So you have a triangular flap that you would turn down, do the surgery through a small opening, and then sew it back up. So the recovery is quicker because there's less scarring because you don't make the incision as long. With the partial knee replacement, again, the arthritis is on the medial side of the knee. For a partial knee replacement, here all the pain is here, and so rather than take off the whole top of the tibia, we'd simply go in and clean out the bone along the top of the tibia here, leaving a rim of bone so that we're allowing them to have the plastic piece sit inside of that for the replacement. On the femoral side, we countersink the bone a couple of millimeters with a burr, and then make some central hole for the peg of the prosthesis. And so our bony resection in the end is very minimal. You can see here, compared to the bony resection on a total knee would be more like a 1/2 inch gap that you're going to fill with metal and plastic. For partial knee replacement, it's much less. With partial knee, we would insert the plastic piece on the tibial side and cement it in with some bone cement. On the femoral side, it would be cemented in so that we resurface that part of the joint, and because it's a smaller incision, it's quicker rehab. Also, it conserves what remains normal in your knee, if it's the kneecap joint which goes up here or the lateral side of the knee which is out here.